Yes, I am here with Dr. Javier Ortiz, and we're going to be talking about a situation that may be, pun intended, a little bit sensitive for some of you this morning, and that is root canals. Good morning, doctor.
Good morning, how are you?
Thank you so much for joining us.
Thank you for having me.
So I just want to get straight to the point. You specialize in root canals.
Yes,
You do them every single day.
Every single day.
All the time.
Every day.
That's what you specialize in. Tell us what exactly a root canal is.
A root canal is a very standard procedure that we do when you have a cavity or an infection that has gone past a place that you can do a filling. Pretty much it's the same thing as a filling. You just go a little bit deeper inside the tooth and clean it better, and then just remove the nerve from inside. And
so you're actually removing the nerve.
I'm removing the nerves from inside the roots. It sounds really painful. It's not at all.
That was my next question,
No,
because everybody always complains about root canals. I mean, I've had nightmares about it. I've had friends that have gone through it, and they say, oh, it's the worst pain. You never want to have it happen to you, but...
No, it's really common. It's pretty much the same anesthetic that we use for a filling. It's just pretty much probably a little bit longer than a filling, but it's not painful at all. You don't feel anything. The post-op pain is pretty much non-existent anymore. So yeah, it's something that we do every day. It's as common as getting a cleaning nowadays.
So basically that's just tied to the olden days, sort of, when we didn't have the good medications and things like that we do now.
Exactly. Nowadays it's very common and very simple, and like I said, very pain-free.
So you heard it here. That's a lie, it's a myth, it's a legend. Not true anymore. Don't fear root canals.
You don't have to. No.
So doctor, you said you go a little deeper. Than a cavity filling. So do you replace that with something? Is there like a crown or a cap? Does it feel different afterwards?
It doesn't feel different. Afterwards, you usually have to get a crown or a permanent filling, depending on the extent of a decay. But yeah, after that, it's the same thing. The nerve, remember, the only thing the nerve transmits is just pain on heat on cold. So the tooth is going to still be there. You're going to still feel it when you're chewing. It's not like you're going to be having something that you don't feel. But yeah, it's pretty much the same thing. It's just, you just have a cap around the tooth, but you don't have any pain, you don't have any discomfort, you don't have any thermal feeling. That's the only thing that you take out of the equation, the thermal feeling. So when you drink something cold or hot, it doesn't hurt.
It doesn't hurt or affect you at all?
Nope.
Okay, and so during the actual procedure or surgery, are there any risks that we should be aware of?
Pretty much no. Nowadays everything is risk-free. Obviously we explain to the patient everything that's happening at the time. Also, it depends on how the patient comes in. If you have an infection and you're swollen, I mean, there's a little bit of post-op sensitivity that happens to that, but usually I would say the first day would be like a little bit of sensitivity if you have a huge infection. If not, people go to work, people go to school, kids go to football practices if they have to. So yeah, it's pretty normal.
And how long does the entire procedure last from beginning to end?
Nowadays, we can actually do it even under an hour.
Really?
We have all this technology at our disposal that we can just do this very quickly.
Almost on your lunch break. Just come in and get it taken care of right there and then. How perfect is that? And so, doctor, is there anything else that you want to tell us about root canals?
I mean, I know that we have a bad reputation about it.
You're the most hated dentist out there.
I know, it's kind of silly, but yeah, it's just something that you have to put in your mind that it's very common. There you have options on sedation. We have options of nitrous oxide, IV sedation when a patient is, the anxiety level is something that's beyond a point that you can control.
So go into that a little bit more.
So yeah, we have,
because that would be kind of what I would need. Anxiety, I'd be freaking out.
We have 3 types of sedations that we use. We have like nitrous oxide, which is laughing gas, which is the most safest one. We have giving you a medication like Valium that can actually help you come in and you're a little bit more relaxed, or you can do IV. IV sedation is for an extreme case where the patient is extremely nervous that he cannot even sit on the chair. That's when we do it. But for the most, I've been doing this for a while, and I don't think I have had to sedate not even 5% of my patients.
Really?
So.
Well, and then, big question I just got to ask. Personally, have you ever had a root canal?
I haven't, no.
You haven't? No. Haven't. So you've been brushing well then?
Yeah, I have.
And so, just on a lasting note, if someone maybe watching right now is thinking of having, like they have some pain, what should they be looking out for in case they need, they think they need a root canal? Well,
what we look for in symptoms-wise, like if you have pain on cold that lingers for a while, like for example, you eat ice cream, and then all of a sudden 5 minutes afterwards you're still in pain, that's something that it's nerve-related. Or if you're swollen and you feel like pressure on your gums or whatever, that's something you look for.
Perfect. So that's what to look out for. And how can we get more information?
You can go to Rodeo Dental and Orthodontics.com, and we'll give you all the information there.
Rodeo Dental and Orthodontics.com. You heard it right here. Dr. Ortiz, thank you so much for joining us this morning.